Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth, the Golden Hour That Saves Hearts. And trust me, it's juicier than your cousin's peach cobbler. Here's something that'll wake you up faster than your morning espresso. Every 37 seconds, someone in America dies from cardiovascular disease. That's faster than you can order your latte at Starbucks. But what if I told you that recognizing one critical time window could save your life or someone you love? Buckle up, because we're diving into the golden hour that could literally be the difference between life and death. Now, when I talk about the golden hour, I'm not referring to that perfect Instagram lighting, folks. I'm talking about the most critical 60 minutes after heart attack symptoms begin. Think of your heart like a luxury car engine. When it stops getting fuel, things go south real quick. During a heart attack, your heart muscle is literally starving for oxygen. And just like that expensive car sitting in your driveway, every minute without fuel means more damage. Here's the kicker, eat. Brain and heart tissue start dying within minutes, not hours. We're talking about a ticking time bomb situation here. But here's the beautiful part. If we can restore blood flow within that golden hour, we can prevent permanent damage and save lives. It's like being a superhero. Except instead of a cape, I wear scrubs and drink way too much coffee. But here's what most people don't realize. Heart attacks aren't always those dramatic Hollywood chest-clutching moments where someone dramatically falls to the ground. Nope, entirely true, I can't make this stuff up. Real heart attacks are often sneaky little devils that disguise themselves as something else entirely. Ladies, listen up because this one's for you. Women often experience jaw pain, nausea, or extreme fatigue during a heart attack. You might think you're coming down with the flu or that you overdid it at your spin class. Men, you're not off the hook either. You might feel pressure in your chest, not sharp pain. It could feel like someone's sitting on your chest, or like you've got the world's worst case of heartburn. And everyone needs to watch for shortness of breath, cold sweats, and dizziness. If you're suddenly feeling like you just ran a marathon when all you did was walk to the mailbox, maybe I should see you in the clinic. We need to talk. Let me share a real example that'll make this crystal clear. I had a patient named Sarah, 52 years old, who felt what she described as indigestion after dinner on a Tuesday night. Now Sarah's a smart cookie, but she did what so many of us do. She ignored it. For 3 whole hours, she convinced herself it was just stress from work, maybe something she ate. But then her arm went numb, and that little voice in her head finally got loud enough to be heard. She called 911, and when the doctors got her to the hospital, they told her something that still gives me chills. 30 more minutes could have meant permanent heart damage. Sarah's alive and thriving today because she acted within that golden hour window. She literally saved her own life by listening to her body. So what are the life-saving actions you need to know? First, call 911 immediately. Don't drive yourself, don't wait to see if it gets better, and definitely don't ask your neighbor Bob to give you a ride. The paramedics have equipment and training that can start saving your life before you even reach the hospital. Second, if you're not allergic to aspirin, chew one. Not swallow, chew. It helps thin your blood and can make a real difference. Third, stay as calm as possible and unlock your front door for the paramedics. Trust me, they don't want to waste precious minutes figuring out how to get to you. And if someone can meet the ambulance outside, even better. Every second counts, and we want those paramedics getting to you as fast as humanly possible. So here's what I want you to do right now, and I'm serious about this. Save 911 in your phone with heart attack in the contact name. I know it sounds dramatic, but when you're panicking and your hands are shaking, you want that number to be right there, crystal clear. Next, tell 3 people in your life about these warning signs this week. Share this episode, have the conversation over dinner, make it part of your family emergency plan. Knowledge is power, and in this case, it's literally life-saving power. Remember this golden rule: when in doubt, call for help. It's always better to be wrong about a heart attack than to be too late. The emergency room doctors would much rather see you for a false alarm than not see you at all. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy. And remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.